Hi there. You're with the Birth Whisperer, bringing you global wisdom for your confident childbirth. I am Anna Wild, and today I am so thrilled to be talking with Sharon Wilson about a part of the female body which really deserves more attention. It's a part of the body that we need to take a special care of during pregnancy and after pregnancy so that we don't have those wee accidents later in life. Yes, today we are talking about your pelvic floor. Sharon is a physiotherapist who specialises in this area of continence and pelvic health, and her personal training is so vast, and I don't think it's any exaggeration to say that she's probably one of the most qualified people working in this specific area in New Zealand. She has 3 children, and she enjoys fishing with her family and playing up the river in summertime. So welcome, Sharon.
Thank you, Mike.
So, Sharon, you moved to Australia and lived in Kalgoorlie and gave birth to your 3 children over there. And it was during this time that you specialised in physiotherapy towards this area of continence and pelvic health. Can you tell me what got you so interested in this area? It's not something that people would just choose off the bat.
What I found is just working in normal physio-musculoskeletal, it didn't excite me very much. And when I got the opportunity to work with women in pregnancy and after birth, I just went, yes, I could make a difference here.
Often people will feel a little bit vulnerable talking about this area of their body, especially if they're having problems there. And you seem like a really friendly person and a good person to come and see.
I guess that's a lot of the feedback that I get, is that I'm easy to talk to. And I think that's what makes a good physio in this area, because you are talking about a wee and poo and sexual function and those things that are actually socially a little bit embarrassing, but an integral part of who we are.
So, Sharon, why would someone who's pregnant make pelvic floor care a priority? So what are the benefits of taking care of this part of their body?
I guess if you look at pregnancy, that baby is growing and the placenda's growing and everything's getting heavier. And it's the pelvic floor's job to come underneath and support that life and to keep control of the bladder and bowels all at the same time. So if you ignore the pelvic floor, you run the risk of that musculature and that connective tissue weakening. And then you can end up with coughing and accidentally wetting yourself in pregnancy. It also keeps the sensation there. So it keeps that ability to feel the pelvic floor lift, feel the pelvic floor drop. So I think it increases your awareness of the whole area.
And when would someone start doing pelvic floor exercises?
Look, I believe we all should be, on a regular basis, doing our pelvic floor exercises. And my advice in pregnancy is maintain what you've got. If you're having no symptoms of weakness, then keep going with maybe 3 or 4 times a week doing some exercises. If you start to notice that they're weakening and you might be having issues with the bladder or the bowels, then you need to increase.
So if you're pregnant and there's no real issue, then just, did you say 3 to 4 times a week?
Yeah, I'd be happy with that.
When I was pregnant, I got into a habit of doing my pelvic floor exercises whenever I sat down. Would that be too often?
The only problem that would be, when it would be a problem, is if there's a tightness. So we often think of pelvic floors as being weak and loose, but they can actually be tight and short. So with those women, too much can be tightening them and making them worse.
How can someone find out if they're too tight or too loose?
That's a good question. For me, the telltale sign is normally some sort of pain dysfunction in the vagina, whether it's pain with inserting a tampon, pain with sexual intercourse, pain when they sit down, or abdominal pain. Because tight muscles anywhere else in the body will give you a pain syndrome. Tight shoulders, you often end up with headaches. So tight pelvic floor, you end up with a headache in the pelvis.
If someone has looser pelvic floor muscles, and maybe not a major problem, but occasionally if they cough or sneeze or jump on the trampoline with their children and they might suddenly pee, how do you do pelvic floor exercises? And I know this is a big subject, but can you give people some basic idea of how to do it?
So So I think the important thing about the pelvic floor, first off, is it is a group of muscles that moves gently within the pelvis. So don't expect a huge oomph feel. Sometimes it's a subtle, beautiful lift that you get. And if I just show you the pelvic floor muscles, you can see that they do fill up the whole of that pelvis. But they actually are not flat. They've got a slight curve to them. So that when you do tighten them, you can imagine that you're holding on to wind or stopping a wee, and you're going to try and squeeze and then gently lift up on the inside.
It's a gentle sort of squeezing rather than a really tight squeeze.
Yeah, I find that sometimes when you try too hard, you end up holding your breath, tightening your bottom, lifting your boobs up, using your eyebrows, and we lose that subtle sensation within the vagina that I think is important.
Okay, so it's really important to be relaxing the rest of the body and to feel relaxed at the same time.
That's right. And if you get any sense of squeeze and then a push down, then that would be a very good indication that you might need to go and see someone like a physiotherapist just to correct your technique.
Okay, brilliant. Is there a very simple sort of exercise someone could do?
Yeah. So the first thing would be to sit probably sit down in a chair. So it's easier to do your pelvic floor sitting down or lying down rather than standing. And let all your tummy muscles go relaxed, shoulders down, and just start with some gentle breathing. And then gently, within the vagina, thinking about squeeze, lift, like you're holding in wind gently. See if you can hold for 5 seconds. And then see if you can gently relax those muscles back down.
Will it be hard for some people to hold for 5 seconds?
Yeah, it can be. So there's some of my patients that I get them to hold for 1 or 2 if it's a quality contraction. Sometimes if you hold for 5 or 10, you're actually holding a not so quality contraction. So I do like that.
So, and in time, would someone do several of these or just one?
So you could start, say, if you can hold for 5 seconds, let's go for 5. Let's hold it. Let's drop it back down again. Let's rest for 5 seconds. Give it a break. And let's go again and see if you can get up to 10 probably maximum within a row.
That's something that people could be doing during their pregnancy if there is a lack of tone of the pelvic floor. What happens after the birth of the baby? If it's been a reasonably normal vaginal birth, would it be the same exercise all over again?
We know that 1 out of every 3 women wet themselves after giving birth. And as women, our most at-risk factors for pelvic floor weakness is being pregnant and giving birth. So after having the baby, I think it's really important to reconnect with that area. See what it feels like now. Can you get a squeeze? Can you get a let go? And then working on that, knowing that actually you're going to give yourself a good amount of time to recover. So if it's a subtle lift, celebrate, you've got a subtle lift, but work on that lift and increase it. I think you just need to give yourself a lot of grace and actually give yourself 3 months to see where you are after 3 months before you start panicking.
And it's good to work it into the daily rhythm. So I always used to do a few pelvic floor exercises when I was breastfeeding.
Yeah, I love that. I think as a new mum, if it's your first time or if it's your 3rd or 4th time, you're busy and you're in demand. So while you're feeding your baby, whether it's breastfeeding or bottle feeding, take that time just to settle yourself and work on those pelvic floor. That way you will get it in during the day without making an appointment with your pelvic floor, because that probably won't happen.
That's so true. And Sharon, this is not only going to support us for the rest of our lives and all of the activities we undertake, it's also good for our sex life, isn't it?
Absolutely. And look, that is one area I really do like doing as a physiotherapist, working with sexual dysfunction and pain. But the pelvic floor muscles, if I can bring the model back again, they go around the vaginal opening, these little ones at the opening. The bigger ones on the inside are the supportive hammock ones. So these little sex muscles around the opening, they're the ones that give us sensation. They're the ones that have a huge amount of blood supply and nerve supply. They well and they engorge with sex, and they give us an ability to have an orgasm. So I think that is very important.
Yeah. So you're saying that practicing your pelvic floor, doing your pelvic floor exercises could actually give us increased pleasure sexually?
Yeah, I believe so, yes.
Fantastic. So Sharon, what if someone had had a more challenging birth experience and maybe there'd been a bit more damage to the pelvic floor? Are there things that you can help with in that area?
So this is one area that I'm quite passionate about, is seeing women in their early postnatal period really look after themselves. And so you're talking about acknowledging the birth experience, saying, okay, now I've got some stitches down below, or I've ended up with needing some extra help after baby. I can't stand so well without pain. I can't sit so well. If you are having problems, go and see someone like a physiotherapist and have an assessment done, and let's see how we can help you out.
If you have had a really difficult experience and there is a little bit of damage and pain, you probably need more support, not just with the skills and with the repair, but emotionally to be with someone who can really understand.
I think that's invaluable. Yeah, and if you're worried and you're concerned and you want to know what has happened after my birth, go and see someone and talk it through with them.
Given that you've had 3 children yourself and you've worked with countless mothers, how do you think women can prepare? Is it possible to prepare for birth?
I think so, yes. I think our bodies are incredible and they're designed for birthing. And I think for me it's appreciate your body, get to know it, find out what it's like down below, do some investigations and maybe some perineal massage, and get to know your body, and then never give up on what it's like afterwards. You can recover.
Can you explain what is perineal massage and how do you do it and what are the benefits?
Sure, let's do it. Okay, back to the model. So the perineum is the area between the very bottom of the vagina and the anus. It's called the perineal body, and that area is like an anchor point for many muscles, and it controls often the size of the vaginal opening. So perineal massage is specific massage done to stretch that area and gently get it used to the sensation of stretch, including the skin and the connective tissue and the muscles in behind it. So I recommend women from approximately 35 weeks onwards, and it can be a daily program done by yourself or your partner to gently stretch that area. So you can simply put a finger inside the vagina and stretch it sideways. You can go deeper inside and find the muscles. If they are painful or trigger points, then you can hold those trigger points, get the muscles to relax, and just work on that area. As long as you're going sort of 1 centimetre inside, and you might be finding some little tight spots within the muscle, hold that, see if it can relax and let go, and I think you would be quite safe to continue. Research does support perineal massage within the first birth. And it does say that if you do perineal massage, you have a reduced risk of that area tearing during that birth.
It could possibly be a little bit uncomfortable for some women, so maybe using a little bit of lubricant or oil might help.
Yep, you can use lubricant or oil, that would be fine. I'm a little bit fussy about hygiene down below, so making sure that it's not got chemical irritants in it, or flavourings, or a smell, or a scent. If it does really hurt, then probably not progressing without seeing your midwife or an obstetrician or a physio and just saying, well, this is where I feel it. What is this? Is this okay?
And I just heard you say 1 centimetre from the opening. Are you massaging all the way back to like above the anus, basically, or not?
No, so you're going inside, and then you imagine the vagina is like a circle, and you can go around that circle, avoiding the very top bit, because that's where the urethra is. So sort of from, if you imagine it like a clock, you could go from 3 o'clock round to 9 o'clock.
Okay, great. Thank you so much, Sharon. This has been so instructive and helpful, and I've found it absolutely fascinating myself and learnt some new things about the pelvic floor. And I'd just like to finish by saying, if there is anyone out there watching this video who feels like they would like to get a bit of help, or there's some issues that they're experiencing, Sharon does work on Skype, and she's willing to provide support and sessions to people all over the world. Obviously, she's not going to get hands-on or, be able to do things directly in that way, but there are so many things that she can help you just in a one-to-one session on Skype. So thanks so much, Sharon, and keep up the great work.
Thank you.